Hi, I'm Dr. Janine Johnson. I'm a chiropractic physician. You're watching this video because either you or someone you care about has a thyroid problem, or you have thyroid symptoms. Maybe you've been diagnosed with low thyroid function or autoimmune thyroid, which is also called Hashimoto's disease, which is really quite a serious condition. Now, symptoms of a thyroid, typically you're going to have, when you're diagnosed with thyroid, the most common thyroid problem is low thyroid. Symptoms would be fatigue, you're cold all the time, you have difficulty losing weight. You might even sometimes have difficulty gaining weight if you've got a thyroid that's functioning on a high end. You get mental fog. Conventionally, what happens is when people are diagnosed with a thyroid problem, they are given what's called thyroid hormone. And what that's designed to do is to increase your thyroid stimulating hormone, and they monitor that in your blood, try to keep that at a normal level. Unfortunately, for many people, that isn't the answer to their problem. And I'm here to tell you that there are other options. This introductory video is going to give you just an insight into what some of those other options are. Now, what we do is we try to get to the root of the problem, and what we do is we don't necessarily treat the thyroid condition per se, and that might sound kind of strange. But what we do is we look at the person's physiology by way of looking at their blood chemistry. And we order a complete blood work and a thyroid panel. And we can pinpoint what's happening in the body, what's happening with liver function, gut function, adrenal function. We can look at to see how if the thyroid hormones are being converted properly. This all has effect on how your thyroid functions. So if you have a thyroid problem, it may not actually be a thyroid problem per se. It might be something else that's going wrong in your body that's causing you to have thyroid symptoms. Now, on the screen here, you're going to see that you can fill out the form there. You can request a free DVD and a free report. You can also request 2 free visits, and I'll talk about that in just a minute. But let me get back to how we treat is we look at you metabolically and neurologically, and that's how we look at you differently. We're looking again at your whole physiology. And then we're going to make specific recommendations, whether it be dietary, lifestyle changes, and specific what we call a spot-on bionutritional supplementation to get your body working better. Now, in regards to the 2 free visits, what's involved with that? Well, you first of all, you come in, we're going to find out what you've had done, where you've been, what treatment you've had. We're going to do a neurological evaluation. And on the second visit, we're going to let you know what we found and give you some recommendations and possibly even some additional testing that may need to be done. But I do ask that before you go ahead and schedule to come in, that you make sure that you're really dedicated to getting your problem corrected, that you're ready to take action, that you're ready to make some lifestyle changes and some dietary changes. If you are one of those people that's ready to make a change, please feel free to contact my office, again, for the free DVD, the free report, and of course the 2 free visits. Thank you. I'm Dr. Janine Johnson.